I think one of the great things about Surrey Heartlands is that there's quite a lot of GP engagement already. So we have a chief executive who's a GP, we have a chief medical officer who's a GP, we have a primary care provider leading our primary care transformation who's a GP, we have very well engaged PCNs who already have the right governance in place to meet, share transformation plans and best practice. So we're a long way there, and I would say that they have had input into this strategy and will continue to have input because they're a critical partner in the delivery of our strategy, especially the fuller stock take. Oh, nearly said that wrong.
Juliet, you might want to talk about
I nearly said it.
the link between primary care and secondary care medical education and how that communication works.
I'm very mindful not to press the wrong button this time. So the links between primary and secondary care for medical education, I think, are things that we should really strengthen. I think locally, thinking about working in teams and Claire's work and everyone's work about sharing responsibilities and roles will very much see a move for healthcare professionals to come into the university and have new skills and work together, and very much our students going out learning in that environment. So it's not a surprise to them that this is how we work, how we share responsibilities, decision making, support each other, and just as you were saying, it's not one person doing a particular task and only they can do that task. So I think it's really exciting to truly start to deliver generalism. We've talked about it for a long time, but I think that will certainly be the aspirations from our new school, and how we can, send our tentacles out, and learn absolutely in a valid way rather than in a theoretical way. I'm sending it down.
Sarah?
I think there's also a culture change in understanding that the only answer isn't a GP. And I'm going to extol the virtues of our pharmacy colleagues who are on the high street available, who have the training and the expertise, and frequently have the consulting rooms and a contract in order to provide advice, increasingly independent prescribing, and actually are incredibly accessible. They are a talented group of individuals with an extraordinary ability to be able to support communities. And back to the digital piece, because they are digitally enabled, they have access to the patient care summary. They have the ability to ensure that the pharmacy interaction is also noted on the doctor's, the GP record. And they have the ability then to ask for advice and create the referral through the GP services. So we've got to stop thinking about there is only one door in the primary care. And Claire knows I will say this because I made her ears bleed during the fuller stock take. There are 4 pillars to primary care. You talk about primary care, everybody thinks about it being GPs. It is general medical practices with a full gamut of staff there. Practice nurses, we've increasingly got the pharmacy in there, we've also got paramedics. We then have optometry, pharmacy and dentistry, all available. Stand fast dentistry, I know there are some problems, I'm anticipating a question on that one. But I would like us to think collectively as a community about how we best used our clinical resources along with our third sector and our social care resources. The answer isn't always knock on the GP's door. Actually, there are other people out there ready and willing to support and help, and possibly best placed to, if I dare say so. Claire.
Shimona, do you want to add something, Shimona, from your experience in East Surrey, places like Hawley, which is much more than a GP practice? And what we're doing to there you go.
Yeah, Gillian, so we've got, are we talking about the anticipatory, can everybody hear me?
Yep.
Yeah, we're talking about the anticipatory care hub and the Hawley hub, which is an exemplar in East Surrey. So we've got the anticipatory care hub located. I'm looking at Pramit as well, because just sort of, if I get this wrong, Pramit will jump in. Anticipatory care hub, which is community matrons, physicians associates, and who else is there? A paramedic. community matrons. So it's a multidisciplinary geriatrician from SASH. So it's a multidisciplinary team looking after our frail elderly patients. And downstairs is the Holy Health Hub that Gillian runs, the Growing Health Together. So that's the sort of the garden, the growing the garden and sort of meeting up, having a cup of tea, resources for young adults with learning disability and all sorts. So it's the perfect example of where you can bring real healthcare coordination, MDT kind of model, plus the sort of prevention and the well-being piece together. So it's a really good example.